So I'm okay. So today we are going to talk about value of different genetic testing versus Galleri testing. And here I misspelled Galleri. It should be I instead of Y. And why it's important to talk about that, because cancer takes a lot of lives, and I wanted to explain a little bit what causes cancer, or at least our understanding right now what causes cancer, and what is genetic testing and what is Galleri testing. And again, misspelling on my part. So why is it important? Important because majority of time we detect cancers way too late. For example, more than 50% of lung cancer, colorectal, cervical, ovarian, and pancreatic cancer, they are diagnosed at late stages, and 30% of breast cancer and 20% of prostate cancer. And you can see the prostate and breast cancers are doing better. Part of that probably because people have good screening in place. But even though colorectal and cervical have screening in place, it's still apparently more than 50% diagnosed late. And if you have late diagnosis, it's harder to treat that cancer, harder to bring it into remission rather than just do supportive treatment. At this point, USPSTF, it's Task Force for Preventive, United States Preventive Task Force, recommended single cancer screening modalities, and that is right now a colonoscopy for colon cancer, pap smear for cervical cancer, non-invasive images such as mammography, or for breast cancer, obviously, low-dose computed tomography for lung cancer in smokers, and some blood-related cancers like BPA for prostate tests. Other than that, there is not much of further recommendation and ways to find cancers early on, to detect early on. So what are the root causes of cancer? There is definitely genetic component, and that's what we're going to focus on today. And there is gender component. Obviously, if you are a biological woman, it's much easier to get breast cancer than for men. And trans women still have higher chances of breast cancer than biological men, but in between biological women and biological men. So gender plays, and obviously women cannot get prostate cancer because they just don't have prostate. And so gender plays a role in different versions of cancer. Toxins, and we talked about the toxins back at the beginning of this program. The environmental, we know that pollutions from different factories or whatever can be detrimental and can cause a lot of cancers. Heavy metals, from whatever reasons, smoking. Aflatoxins comes from molds. Mold toxicity can become pro-cancerous. Medications, including hormone replacement therapy and some other medications that can be associated with cancer. Plastic bottles, or different cookwares, and so on. And alcohol. Alcohol by itself apparently causes a fair amount of cancer. Then we talk about radiation, starting with sunburn that will be associated with melanoma, skin cancers, X-ray, and CAT scan radiation. And CAT scan and X-ray, it's similar radiation. Then we have alpha and gamma radiation. So if people in Hiroshima and Nagasaki bombing had a lot more cancers, people after Chernobyl had a lot more thyroid cancer and other versions of cancers. And now we realize that electromagnetic radiation as well can be associated with cancers too. And EMF is pretty much everywhere. It's our 5G towers, it's everywhere. Then systemic inflammation states like diabetes mellitus type 2 and obesity have much higher chance of cancer. Then high stress and sleep deficiency associate with cancer, possibly because when you have high stress and sleep deficiency, you may have disruption of cortisol, HPA axis, and that affects the immune system, and that affects the cancer development. Any other weakened immune system, like Epstein-Barr virus or infection with HPV or such, that will lead to or can lead to cancers. Unsafe sex, that leads to infections, and alcohol, I put it separately, and then diet. Diet plays a huge role because a lot of micronutrients are required, and micronutrients, macronutrients, and vitamins required for proper function of immune system. And if you don't have it, then you get abnormally working immune system, and as a result, a problem. So this is, I love this very complex chart from cancer research from UK. You can see in proportion how much different components contribute to cancers and how many cancers can be prevented. And you can see that tobacco by far prevails in lung cancers and esophageal cancer, bladder cancer, and in general is the largest one probably. Then the weight issues play a role in breast cancer and bowel cancer, gastrointestinal cancers, and so on. And you can see how a lot of things can be changed. Having more vegetables and fruits will affect a lot of cancers that are listed. So pretty much a fair amount of cancers are preventable and relate to our lifestyle, unfortunately. So how does cancer start? At this point, we feel that cancer starts from stem cells, cancer stem cells. And all the cells start out as non-cancerous. Then you have mutation in one of those cells, and it's called founder cell mutation, or founder cells like a stem becomes a stem cell. And that founder cells start dividing, and there could be another mutation in the same tumor, and there are several mutations. And as they divide, there more mutation accumulate, and that can lead to cancers. Another hypothesis is this cancer stem cells postulates that the group of stem cell-like cells is responsible for development and progression of disease. So it's not only those cells, they kind of keep dividing, and because of that, they highly proliferative, and they forming the tumors. So we have those tumor initiating cells, as they said here, and then you have bulk of tumors of other cells. So what are the gene mutations? We call them somatic gene mutation that could be found. And you saw in that picture mutation 1 and 2 and 3. They could be affecting different parts of the cells, and some of them will be tumor suppressor genes. And tumor suppressant genes supposed to suppress production of tumors. But if you have a mutation in that particular gene, then tumors are free to start propagating. Then we have oncogenic KRAS gene that in normal condition, that gene is just suggests available or helps your body to grow the cells. But when the mutation happens, then this cell proliferation, cell growth becomes uncontrolled. And then VEGF is anti-angiogenesis gene, and which means if you have tumor with gene mutation in this gene, it will start growing blood vessels excessively to help the tumor growth, because obviously if you don't have blood cells toward tumor, the tumor will suffocate and may not propagate as well. On the other hand, when we have low oxygen, that increases chances of having more cancer stem cells, and the propagation of tumor may become worse, and so on and so forth. So there are a bunch of those genetic mutations that can start accumulating and cause the cancer. However, it's interesting that you can see that breast cancer, for example, and we'll talk a little bit about that, there are quite a lot of people under age 50 who are diagnosed with breast cancer. But majority of breast cancers actually after age 50. And survival rate is improving. 8 in 10 women will survive breast cancer for at least 5 years. And that's great compared to, let's say, 1971, when it was just 50% of women with breast cancer survived. And we don't know exactly if that's improvement because we started detecting breast cancer earlier with mammograms and everything, or is it because the treatment is so much better compared to before? And possibly it is both. So when we look at breast cancer, there will be only 10 to 15% of women who have breast cancer with known mutations. And those mutations will be genetic mutation that you pass from one generation to another, not the somatic mutation that we talked about before. And unfortunately, people with those genetic mutation end up having earlier breast cancer in 20s and 30s. And the majority of, as you can see here, between 85 to 90%, there are no genetic mutation, and most likely than not, they will be later in life cases of cancer. Of those that have known genetic mutation, 30% of BRCA1, BRCA1, and BRCA2 is another 30%. And the rest of 30% will be divided in all kind of interesting cancers that are less known, but still get checked, and check one, PTEN, ATM, and so on and so forth, Lynch syndrome. So all of them are known causes of genetic mutation. And so how is it, what does it mean if you have this mutation? So BRCA1 and BRCA2, more common ones in general. And if you have a mutation, there is about 70% of chance of developing breast cancer in a lifetime, according to a new study. And that's for women. I didn't look for what for men, but it is known that men can get breast cancer, especially if they carry one of those genes. They definitely have high chances, men with BRCA1 or BRCA2 have high chance of developing breast cancer. So in general, BRCA gene is known as tumor suppressor gene, so it would reduce progression of tumors. But if it's mutated, then it stops being tumor suppressor. And as a result of that, it allows for whatever other gene mutation to happen and tumor progression to occur. And BRCA1, BRCA2 frequently associated with breast cancer and ovarian cancer. That's why you probably have heard that Angelina Jolie, she lost her mother to breast cancer, and she herself decided to have bilateral mastectomy and oophorectomy, meaning she had ovarian cancer. I mean, prevented having ovarian cancer as well. And so the top statement, the lower statement, they come from two different places. And the lower one says that you have 85% lifetime risk of having breast cancer if you have BRCA1 or BRCA2 rather than 70. So it's probably between 70 and 85, and between 20 and 40% risk for ovarian cancer. It's interesting that people could have mutation in a cancer, but it may not be clinically significant. So you may have that point mutation when T got substituted for C or whatever other numbers or letters, but periodically people don't know if that particular substitution in this particular place will actually lead to increased chance of cancer. So those mutation called variants of unknown significance. And why is it important? Because that's when I'll talk more about particular genetic testing, they actually look at those variants and keep track of them and keep reporting and updating their clients and patients' information. So in addition to affecting breast cancer, breasts and ovaries, BRCA1 and BRCA2 can be associated with pancreatic cancer. And for carriers of BRCA2 gene, you can see here it's and BRCA1, life risk of developing pancreatic cancer is estimated between 5 and 10%. So it's important to keep an eye on those because you cannot just go and remove the pancreas. So we have to keep an eye on pancreas in people who are carriers. The American, I think it's Association of Cancer, which I don't remember ASCO what stands for, but it's provides recommendation and it suggests genetic testing for affected and unaffected individuals, one from familial cancer families or from family, or if you belong to family with several pancreatic cancer, it's a good idea to have that checked. Number two is from families with 3 or 4 or more diagnoses of pancreatic cancer. So to me, it sounds like familial cases too. And 3 is who meet testing criteria for genetic syndromes with increased risk of pancreatic cancer. So definitely a good idea to be checked. And it's, I didn't realize that BRCA1, BRCA2 mutation is associated with high chance of prostate cancer as well, even though the number of men with actual gene mutations is fairly small compared to everybody with prostate cancer. It's only somewhere between 1.2 and 3.2%. Only in Ashkenazi Jew, that gene mutation becomes kind of more toxic, and it's 5.2% of unselected patients with prostate cancer. So again, having this BRCA genes important, not only look at breast, ovaries, pancreas, but at prostate cancer. On the other hand, prostate cancer could be associated with a few other mutations and genes, and they're listed here: HOXB13 gene, there is Lynch syndrome, and several genes related to that, plus CHEK2 and as NBS1 and so on. And CHEK2 is one of more known cancer or genes that associated with breast cancer and apparently with prostate cancer. So it's one of things that you start remembering after seeing a few times. Being an endocrinologist, I definitely want to share about the MAN gene and MAN syndrome. It's multiple endocrine neoplasia that type 1 will affect pituitary, parathyroid, and pancreas. Those are usually not even cancers. Usually they're benign tumors, but still it's interesting how this one gene that promotes production of protein called menin affects so many tissues. And it's usually it acts as tumor suppressor, but if it's broken, if it's has mutation, then that tumor suppression action is reduced, and therefore it allows for faster growing and dividing cells in uncontrolled manner. And As a result, people may have, for example, gigantism or prolactinoma from pituitary, parathyroid, primary hyperparathyroidism with elevated calcium, and some tumors of pancreas that can cause either too low blood sugars because it's some kind of insulinoma or some other crazy interesting tumors in pancreas. Again, majority of them are not even cancers, but it's interesting that they keep growing in multiple sections of the tissue and affect the person's function quite a lot. I had several families I took care of throughout my life of endocrinologists with those, and they do have some other strange additional features, tumors in skin or some other things that could be interesting. So, and we have MEN2, which comes as MEN2A or 2B, and MEN2 is as here it's much more aggressive case because they end up with a thyroid medullary carcinoma, and usually it will be pretty much in 100% of carriers. About 50% will have pheochromocytoma, 95% of those will be benign, and about 5% will have cancerous pheochromocytoma. And then there will be primary hyperparathyroidism in 20 to 30%, and in some cases there will be none at all. And same gene can be responsible just for thyroid medullary carcinoma, familial MCT, we call it MCT, thyroid medullary carcinoma. And here the gene is a red gene, and that red protein controls division and regulation of cell death and apoptosis. And guess what? If you don't have apoptosis, you cannot have a cell death, then you have cell proliferation, and that becomes uncontrollable and creates cancers. Depending on which version of the gene mutation, if it's highest risk, then the babies are supposed to get thyroidectomy within first year of their life, because otherwise they will get cancer, very aggressive one, within that first or second year of their life. Then high risk, there should be prophylactic thyroidectomy by age of 5, and then with moderate risk, it should be in childhood, and technically you still can monitor that. And it just, we don't know exactly who will get which kind of gene mutation, but because we know that it's this particular gene mutation or that particular gene mutation, it can help to determine which way to go. So here is SEMA4 signal hereditary cancer panel guide, and that's the I wanted to share because I just went on dinner talking about this particular company, and they offer all kind of genetic screening for very reasonable tests. It's cheek swab, and they have for cancer 107 cancer genes in a sense, or yeah, it will be 107 of them. Many times obviously you have more genes you screen, more of those variants of uncertain significance you will get, but if something is positive, then it's positive. And what I like about this company, they do include genetic counseling to their to people who got that tested. Usually it's covered by insurance. If it's not, it's $250, and I think it's good investment in health. And therefore, I'm just sharing this because it's available for our office. I haven't had the guy stop by to bring us paperwork, but I will. I know he's going to stop by and share with us paperwork so we can start ordering that. On the other hand, we have Galleri testing. Galleri testing we already have for about a year. It's been approved by FDA, and what it is, it's if you have tumor, no matter what kind, genetic predisposition or not genetic predisposition, there will be pieces of that tumor floating around in your bloodstream. It will circulate. And that's what this particular test does. You get the blood draw, and they call it liquid biopsy. And because of that, they can amplify those genetic pieces of tumor cancer cells, and they will be able to detect it. And because of that, they can predict if person already has a cancer. There are several different companies that do similar testing. It just Galleri testing does a lot more of the tumors compared to the other ones. And here, different companies or different sets of testings. Some of them include 7, some of them include 8 cancers. And what this page shows is how accurately you can detect cancer using their technology. And more advanced cancers, stage 3 with CAP sequence, for example, there is 100% detection. That's great. Other ones, less so. And I probably wouldn't be using tracer because it's only 57% for stage 2 or 7 or stage 3. But just to give you understanding of that technology is somewhat similar, but slightly different. And we use the Galleri test, and because it's approved by FDA, it's not yet on panels of insurances, but I hope it will become available. Right now, as it is, it's quite expensive. It's about $900. But for some people, it may be worth spending that much money. We never want to do this test in people with active cancer, known cancer. And here, between for stages 1 to 3, the sensitivity was about 67%. And that was 12 cancer types that they did that particular study. And with increasing stage, the sensitivity becomes higher and higher. For stage 1, it's only 39. For stage 2, it's almost 70. Stage 3 is 83, and 92% for stage 4. If you look all cancer types, they have, I think, close to 70 different cancer types. Then sensitivity obviously is not as accurate, but still it goes up to 93% in stage 4. So, summary, for genetic testing, you definitely want to test for familial cases. Even though number of familial cases is very small, if there is family history, it's a good idea to be tested. If there is family history of early cancer, even though there is nobody else in the family, it's still worth to be tested because there could be a new mutation in that particular person with early onset of cancer. So it's definitely a great idea. Technically, you can do once in a lifetime that genetic test because your genes are not going to be changing, but somebody needs to keep track on those variants of unknown significance and see if as time goes on, as we gain more knowledge, if that unknown significance becomes known significance, either yay or nay. Do we get to know if it becomes associated with cancer or not associated with cancer? So it's a good idea to have the company who is like this SEMA4 company keeps track and keeps notifying patient every so often if they found new information. Then summary, I mean, the genetic test shows the risk of developing cancer, but does not show the actual cancer. And definitely genetic counseling is very, very highly suggestive if you have positive test, or if you have variants of unknown significance, just to kind of put mind at ease if they have just those variants of unknown significance. For Galleri test, it's a great screening tool for everybody. Obviously, as we become older, we start having high chance of getting cancers. So older people will have higher prevalences and therefore will benefit from this definitely more. I can see where it could be used in younger people with one of those genetic tests. So if person who carries BRCA1 test wants to keep having Galleri tests every couple of years or every year, that is a great way to look out for possible development of pancreatic or breast cancer or prostate cancer. But it does need to be done repeatedly. It does cost quite a lot, it's not covered by insurance, but it does show the actual cancer with quite good sensitivity. And if it's positive, you need to see an oncologist and see what needs to be done about further treatment. I think that's all. I will stop share and we will talk. So, and stop the